blood transfusion is an organ transplant. Salam. Blood transfusion is an organ. إذا شنو يساوي blood transfusion? Organ transplantation. The first successful organ transplantation is a blood transfusion. واضح ولا مو واضح؟ Why organ transplant? Because blood is a tissue. blood tissue ولا مو tissue؟ ها؟ هاي هذا السؤال. يعني واضح؟ إذا هسه طلع الترانسفيوجن organ transplant. Then the definitions اللي حكيتهم كلهم صحيحات. But it does not touch the heart of the fact. اللي هي طبيعة فلهذا احنا لما ننقل البلد لازم نعامله معاملة organ transplant. In terms of indications, in terms of complications, and in terms of monitoring. نعرف انه when we do blood transfusion, we are not giving a normal saline. We are not giving an oral tab or injection. It is a donor transplantation from it's a transplantation from a donor to a recipient. So it should include all the precautions and measures and guidelines that cover the process of transplantation. Transplantation could be fatal. Transfusion also could be fatal. بس احنا ما سمعنا في اليوم واحد اخذ مقدمات. Transplantation it might be associated with rejection. Blood also associated with rejection. Blood transfusion might be associated with extra need for measure rather than transfusion itself, so as the transplantation itself. Organ transplantation need a donor information, full donor information in terms of history and physical and clinical well-being. And blood transfusion is also as an indication to assess the patient both physically and clinically and biochemically and even on the term of hematological status of the body before doing or receiving. So don't take blood transfusion as easy as it is imagined in the data on people. والله انا اروح اخذ الدم الطوارئ وجهي يا ابو هذا فيتر هذا be complications. You might lose your life from this single point of blood. هو الناس راح تيجي ابهزرت. فلهذا please don't allow or give blood unless it is strictly and clinically and ethically and regionally legally indicated. Because you will be asked about all of these in the HTS. هسه مفهوم شنو البلد ترانسفيوجن؟ طبعا انا دائما في المحاضره مال البلد هالشكل، لانه انا اعتبر هاي الفاكت هي مور امبورتنت ذان اني فاكت اللي هي وكل العالم هسه تسال حتى بما في ذلك الاطباء يا شنو المحاور شنو تطيب الدم؟ محمد تنقل الدم انت هسه لو واحد تعطي واحد تنقل له رينال ترانسبلانت اذا موديكيتد شنو الكومبليكيشن مال رينال ترانسبلانت؟ also has a rejection. Should complication can be renal transplant fatal? The answer is yes. So is the blood transfusion. والله النسائية تقول هاي الهيموغلوبين مالها 10 خلي تهدم قبل ما تسوي العملية. ومن سائل ايش حقي؟ أنا غير أني أمشي I follow the rules. I follow the rules and guidelines. وشنو الوزة إنه أنا تغلط؟ أنا أقدر أعطي التخدير يقدر يعطي تخدير وحتى الهيموغلوبين 8. ليش تغلط ترانسفيوجن؟ أنا ما تغلط إذا ما كان it is life saving and it is strictly indicated. فأخوان don't take a blood transfusion as easy as the others imagine. ما أقول أنتم as you imagine. The others imagine. Fair enough. Now we come to the core of the lecture. A vehicle organ that perfuse all other organs. Blood and interstitial fluid deliver nutrient to the cell and remove wastes. Hemostasis. الجد كانت صحيحة؟ العاب ما مشغل؟ هاي مشغل تشغل تعمل رعد. رعد هاي رعد. Hemostatic cables are carried to and from the appropriate site. Okay? Okay? What is the function of blood? You know, blood constituent is of two constituents. Cells and plasma. Suspended cells include RBC and that carry oxygen, related that contribute to the hemostatic process, and chemicals dissolved in plasma, nutrient, waste hormones, etc., metabolic heat for disposal. So, regulation, plasma contains pH buffer, plasma where water absorbs heat, the plasma solute maintains osmolarity. And by osmolarity means the percentage of solute to the solution. Protection, plasma precursors protein from blood clots and well stimulated. Suspended white PC attack bacteria and viruses body defense. Plasma contain antibodies and abstinence for immunity. هاي الشغلات تعرفوها انتم بداية تجيكم يعني معروفات بس اللي تعرف انه how much from the white PC are usually present in the circulation and how much is not present in the circulation and where it lives and so on. I know it is the job of hematologists, but I am noticing that it is a usual defect in the information of the medical student to know where the white PC resides during the rest of the body. Anybody? Nobody. I will tell you, most of the white PCs and the rest of the rest status of the body in the sedentary status, it resides along the endothelial lining of the vascular bed. Why? You can imagine that the white PC is a guard. What are the white PC? They are a guards. So, when there is no threat, where does the guard spend their time? ها؟ حراس وما عليهم تهديد وين يروحون؟ ها؟ وين؟ لا أنا أحكي لك guard الحرس. When they have no threats, where they spend their time? More? So the endothelium of the cell is the gates of the prison or the protective field that the guards work. How the information will reach the URPC and there is a threat and they bring it to the plasma? By signals. Signals sent by cytokines, which is liberated by the effector cells responsible for the immunity. So, is it necessary that all the time what we see spend their ATP running and, without function in the blood? The gut says no. Let them rest, and they come when we are in need of them. So this process of rest of the white PC along the wall of the blood vessels is called margination. The margination is the process by which the white PC get rest along the wall of the blood vessel, strictly speaking, on the endothelial lining, and receive or wait for the signal from the effector cell to be brought and recruited to the field when needed. Okay? This is quite important. Fluid component compartments constitute of 40% of body weight, and interstitium about 15% of body weight. And some of them is 55 body weight, and the rest of the body weight is composed of cellular material and intracellular fluid, of course. You imagine this is the capillary membrane, and this is the plasma, and this is interstitium, and this is intracellular fluid. Plasma plus the cell and cell fragments, and 5% plus about 2 to 3% of body weight. Banked whole blood. This is the bind you'll accustomed to see it during your rest of life. In the pediatric, in the gynecology, in the hematology, in the medicine, in the surgery, you will almost always see this picture. Don't forget. And don't forget to read about these information which is present. And the most important information is the virally screened or not, cross-matched or not, blood labeled or not, because most of the blood transfusion problem is resultant from a human error. And one of the most important human errors is the ignorance. And lack of information about the cover of the binds is one of the human ignorance. I remember that there was a patient lying in the RCU, and he was a strict indication for transfusion because he had been sent to shotgun in the abdomen and massive bleeding. And during the problem of management and the emergency status, one of the blood that was belonged to other patient, that patient was shocked, extremely shocked, and we were warming the blood 2 bind by 2 binds and give along 2 lines. And one of the blood that's been warmed for another patient jumped to the pool of blood that was given in the hot normal saline for routing. And unfortunately, it was given to the patient by error, and patient spent his life for this mistake, and he was died. The mistake. The difficult is the payment. Can be stored for at least not more than 3 weeks. The newer the blood, the more advantageous value to the patient. The most old, the less the advantage, because it will expand the oxygen carrying capacity. Transfusion of the whole blood is rarely required nowadays because we have machines that can segregate the constituents of the blood and can give you whatever you want. most patients will need to augment the oxygen carrying capacity, and by that we give what? Packed RBCs, which is stored in a small bag like this, not more than 200 to 300 ml. It can be given quickly and can augment the oxygen carrying capacity, and you can give another type of finger that augment the circulation. And for example, ringer lactase. Also, it is free of some allergic constituent of blood, and make the complication of blood transfusion so much lower than when we give whole blood. Stored in the refrigerator, the platelets are useless, and factor 5 and factor 8 are greatly reduced. Why platelets are useless? Why? Anybody? Allowing? ليش بابا platelet useless? Because of the half-life of the platelet. Clear or not? The half-life of the platelet does not exceed 3 days. So your platelet is renewed every 3 days, while RBCs is renewed every
120 days.
Yes, excellent. So you have opportunity to replace the blood RBC when the blood is old, while if you need to replace the platelet, you have to give a fresh blood. And as far as fresh blood, it cannot be given routinely without viral screen, so we have to sort another solution, which is platelet concentrates. Okay? Transfusion of the whole blood may be necessarily contain type of major surgery, acute blood loss more than 15% of the vascular volume, major trauma such as car accident or gunshot wound requiring emergency surgery. Because at that time the whole constituent of blood are needed, because the whole constituent of blood were lost. Okay, this is one of the unique indication for whole blood transfusion. Change in the RBC. What change of the RBC when the blood is stored? pH from 7 to it will be, so the blood will be acidic rather than neutral. The 2,3-diphosphoglycerate enzyme, which is necessary for the oxygenation and delivery of the oxygen and responsible for the positive oxygen dissociation curve, will be reduced. Intracellular ATP, which is adenosine diphosphate, and oxygen transport and energy capability expenditure exchange will be greatly reduced. Poor sources, platelets, and clotting factor مثل ما قلنا لكم 5 and 8. Increase level of the following constituents: lactic acid from 20 to 150 milligram per deciliter, which is very harmful and responsible for the acidity of the blood, toxic stored blood. Why? We don't increase the acidity because the patient is already stuck with metabolic acidosis due to trauma and shock. So giving stored blood would complicate the situation. Potassium, which is liberated from the decayed blood cells, will also rise in the serum. Besides the increase in the potassium level due to trauma itself during intracellular liberation of potassium from the injured site. Ammonium concentration also rise. Hemolysis is insignificant because the rate of the hemolysis is not rapid and the constituent that resulting from hemolysis is evenly distributed through the volume, so the concentration of the hemolysis products will be evenly reduced, and the acute toxic effect of the hemolysis, not like the hemolysis which happen intravascularly. هذا السؤال دائما ينسال، يقول مو ستورد البلد يصير بهيموليسيس؟ ليش الهيموليسيس بالبلد يصير extremely useful, harmful, while hemolysis in the stored blood not? This is the answer for this question. Why fresh blood is not administered within 24 hours of donation? It is already indicated, واعتمد من قلناها هسه اللي هنا when we need fresh blood and it is poor source of platelet and factor VIII unless given immediately. What are the blood components? The process of transfusion only that proportion of the blood needed by the patient, as we told you just before a few minutes. It allows single unit, 1 unit of donated blood to benefit more than 1 patient. When we give single pint, it might be given to 10 patients. 1 need platelet, 1 need factor concentrate, 1 need frozen plasma, 1 need plasma only, 1 need RBCs, 1 need plasma constituent, and so on. So we will generalize the benefit of the blood to the more than 1 patient rather than give it to 1 patient. It allows a single unit, 1 unit of donated blood to benefit for more than 1 patient. Red blood cells and platelet are the most frequently transfused blood components. Packed RBCs, the red blood cells from the donor unit with plasma to the hematocrit about 75%. Volume is about حكينا لكم اكو بها 200 ml and اكو بها 300 ml. Stored RBC just above freezing allows survival for 42 days. But unfortunately decrease in the, as we told you, the 2,3-diphosphoglycerate enzyme and ruins the platelet and the neutrophils. Why platelet and the neutrophils? Because it has a limited lifespan. Being the platelet 72 hours, what about the neutrophils? Anybody? Anybody? شكل عمر النيوتروفيلز؟ ها؟ يا جماعة ترى هذا ما يصير والله. انتم على بس الروح اذا ما حد يسالكم انت اسال روحك وروح دور عليه بالكتب. اكتب بالجوجل بس. لا يفضل نيوتروفيلز تطلع لك رسمة. يعني ما سالفة بحياتكم يوم النيوتروفيلز قد عمرها؟ 6 hours اخوان. شو بيكم؟ hours. Hours. ليش خلى hours? Because we are every minute we face a new enemy, a new organism. So it has to be changed to be antigen labeled. لو انتم ما ماخذين immunity. أخذت immunity؟ ها؟ ما سألت عمر ايه؟
ما اخذنا يعني ما
لا تقول ما اخذناها، ابوي يقول انا ما تعلمت، حتى لما انطوك اياها، انت شغلك تتعلم. انت don't be bothered by asking yourself why and how. يعني تفاعل ما عندكم يا رواحكم. Recent advances have made it possible to store blood cells up to 42 days, and its indication acute trauma before surgery, people with anemia who are having surgery for correction. RBCs reduce the risk for infusion antigen of foreign bodies that the body might regard potentially dangerous previously sensitized patient. هذا اللي هو مسؤول عنه الماينر بلاد ترانسفيوجن رياكشن. اكو ميجر هسه نعطيكم اياه transfusion reaction and a minor blood transfusion reaction, and this is one of the causes of minor blood transfusion reaction. Not available for the use in the emergency situation, and RBC viability is improved, ADP and 2-3 levels is maintained. Why? Due to frozen, and you know these enzymes are slowly decayed in the low temperature. Okay? Platelet concentrate component platelets 50% of plasma. Cellular components that help in the clotting processes. Platelets are stored for up to 5 days at room temperature. Indication. Platelet must be stored لما يرجع لفوق السن فوق للجو.
فوق يرجع جو انتهى.
اي يعني بس بس يمكن 5 سلايدات. مرات يغير هذا يمشي. Components platelets 50% ml plasma cellular components that help in the clotting process. Platelets are stored for up to 5 days at room temperature. You know the indication used in the platelet disorders when massive blood has occurred. ليش بالماسف blood platelet؟ من يعرف؟ ليش بالماسف نحتاج بليتلت؟ نحتاج بليتلت ونحتاج كالسيوم. بعد. اي انت تحوس قوم احكي قوم. عندك انت في الشغل ولا الورق. قوم.
طيب البليتلت
قوم دائما يحكي قوم يبرز شخصيته على ما يتعلم.
هسه عندي بالماسف بلاد تصير يوز عندي لي بليتلت يوز لي كوغلسين كاسكيد نعطيهم كالسيوم وبليتلت عمود يساعد لي كوغلسين كاسكيد. يعني
لا تشمش علي. قل لي ليش نعطي بليتلت وجمله مفيده واضحه.
تساعد عمليه الكوغيليشن.
نعم هي بالنورمال مهم تساعد عمليه الكوغيليشن.
مساعده ديبليشن للكوغليشن بلاد. يعني راحت هي بالماسف بلاد اللوس راحت يعني سواء حسب الكوز مالتها.
هو كلامك صحيح. It does not tap the heart. شوف استريح. احنا بالماسف ايش راح يصير عندنا؟ وقال لك تعالي بس شو بتشعل على بالماسف واحده من الكومبليكيشن مال الماسف شو يصير؟ DIC. and DIC the other name شنو مالها؟ consumption coagulopathy. So when the coagulopathy consume the constituents of the coagulopathic mechanism, and one of them is the platelet, so you have to replace it. هذا الجواب الرسمي. Okay? So given in the massive blood loss. Platelet must be stored at room temperature, so are good only for 5 days مثل ما حكينا. طبعا هي 5 days حقيقة هم يحكيها عنها. But actually, after passing the 3 days, usually it is useless. 1 unit will usually recite the platelet count إلى 5 إلى 10 per microliter. خوش. Check the hour 1 hour after transfusion. should be done when we want to guarantee that the platelet count will be raised. If the platelet count does not increase as expected, refractoriness, suspect either DIC or immune platelet destruction, anti-HLA. From freshly donated blood, fresh frozen plasma, source of vitamin K dependent clotting factor. هاي لو عندنا مثلا patient صار عنده over depletion of clotting factor due to many reasons. One of them is the usual we are facing in our medical practice is the previous ingestion of anti-vitamin K dependent factors مثل ايش؟ وارفرين اللي هي تنجمع بالرقم 1972. Okay? So when we want to do surgery, you have to replace all of these before doing surgery and to abolish the effect of warfarin. It is the only source for factor 5 and indication for coagulopathic or deficient clotting factor. And this equation, 1 unit of frozen plasma equal to 3% increase in the clotting factor, at least 30% to ensure adequate coagulation. You need at least 30%. Cryoprecipitated anti-hemophilic factors. تعرفون انتم الفورمولا براند والهيموفيليا. The only way to replace the deficient is by giving the deficient elements. It contains a major portion of factor 8 and non-von Willebrand factor, and fibrinogen and factor 13 and fibronectin present in freshly down and separated plasma. Replacement therapy, serologic compatibility ABO and RH group. Cross-matching and donor RBC and the recipient serum, which is the major cross-match. Serological, these are the way we are doing the cross-matching. You give them anti-A, anti-B, anti-AB, and we wash the patient, and anti-D, and UH for coagulation. If all of these are not resulting in coagulation, the blood group is O negative. O negative. هاي مرات يجيبوها سؤال. During cross-matching, if the patient sera didn't respond for any of the constituents of the solution, what is the role of the patient? RH negative recipient should be transfused with RH negative blood. RH negative group, 15% of population and limited supply. So RH negative should only be given to RH negative. وما يأثر على RH positive, but it should be preserved for RH negative because the RH negative is only 15% and you might not be able to get RH negative blood. While RH positive blood, it has a lot of people to donate for them, while RH negative has a limited number to donate for them. Clear? مو يجيك واحد يقول له والله يلا ما يخالف طيب RH negative يلا يرحم ما يصير سنة. No, yes, it is useful for him, but it should be preserved for those who are RH negative, and they will be difficult to take or to supply RH negative blood for them. due to the limitation of the number. This is a practice. You will read it with yourself and answer it. Same. This is important for you. I put it in the lecture to remind you the clinical status of blood loss after each percentage of blood volume have been lost. You have to know it by heart. You have to diagnose the level and the amount of blood being lost during the first glance to the patient. واضح? And this is the guideline for you. And I used to give a question or two about this table. يعني هذا تخشيش بس تخشيش من أجل المنفعة لازم تعرفوه. Usually we give a question or two in the MCQ for this table. Of course, with some modifications. Risk from the unit of blood ordinary RBC. Non-hemolytic febrile confusion reaction up to 5%. Minor allergy up to 2%. Real anaphylaxis may be 1 in every 20,000. Fatality rate unknown. Transfusion reaction, the other type all are transfusion reactions. Hemolytic, allergic, febrile, bacterial, circulatory overload and hypothermia. When does these occur? They have special causes. There are special causes for each one of these. مثلا نقول لك بالهذا the following are complication of giving blood for a patient in terms of 5 units of blood. 5 units of blood. أذكر لك بني وأقول لك hypothermia. إيش تختار؟ أذكر لك بني بس أقول لك hypothermia. hypothermia اختار ليش؟ لأنه الhypothermia عادة it is associated with more than 4 units of blood donation or recipients. مثلا pediatric age group of 2 years received 600 ml of blood. The following could be a complication immediately. أكتب لك hemolytic, allergic, the most appropriate. Febrile convulsion, volume overload. Volume overload. لأن كلهم يصير. But you have to judge which one is most important to occur in these circumstances. So you are not only responsible to know the complications. You are also responsible to know which complication has happened in such or other circumstances. أو مثلا أقول لك on receiving a blood transfusion to a patient due to a chronic anemia, hemoglobin was 6 grams per deciliter. With a few mLs, the patient developed reactions. What is the most important measures to do? مثلا أكتب لك مثلا treatment of overload, treatment of hypothermia, decontamination due to bacterial, reduce the febrile reaction by antibiotic, giving him anti-allergic measures. 15 سي سي مو؟ إذن هذا allergic reaction. Could be febrile reaction بس أنا ما قلت لك febrile patient. فالشارع تختار. فبليز think about complication. It is not a simple enumeration. Please think about it and imagine when it can happen and how we can treat. Clear? Allo immunization, graft versus host. احنا ايش قلنا ذيس؟ قلنا البلد شنو هو؟ قلنا blood transfusion هو عبارة عن شنو؟ So شنو graft versus host disease؟ The body? Like that would happen due to usual transplantation. Transfusion-related acute lung injury. Why? Because one of the causes of ARDS is the so lung injury is possible or not? It is cytokine mediated or not?
Yes.
Okay? لازم تفكرون بيه. هذا البقية يعني خلينا نقول عليه it is simple. Allergic, anticarrier, and you know all of them. There is no need to. Hemolytic reactions is important, and you have good detail due to incompatible blood, major or minor incompatibility, and it is of course a major of life-threatening is the ABO incompatibility, as happened to the patient I just told you about. There is another type of hemolytic reactions, immune-mediated, and the hemolysis and hemolytic reaction is clinically known to you. And the most important of which is the immediate passage of urine, hemoglobinuria. فلهذا don't forget to ask the patient to urinate if he has any sort of complication of blood transfusion to exclude hemolysis. By all types of hemolysis, it will be evident in the urine of the patient in form of hemoglobinuria. واضح؟ What about hemolytic reaction happen in the intraoperative period? Sometimes we have to give the blood during the operation. What is the marker? Present sending, doctor, the Foley, is the patient is fully supplied or not? Present sending, أقول لك not, there is no Foley. طبعا عادة when we give blood, the circumstances of the patient that indicated for blood transfusion usually govern to put him to put a Foley for a patient. It is allergic for the situation. But if I ask you, no, what you will say? So, doctor, I will put a Foley. Why my son? Why give him Foley? You need to monitor the color urine of the patient. It might be a hemolytic process. What is the other markers or clinical criteria in patient receiving blood intraoperatively?
Myelonephritis?
Yes?
Myelonephritis?
Late. But we are talking about the immediate. The immediate. Yes? Late. Hypotension.
hypotension, the anesthetist will tell you that your patient is hypotensive. And you can judge the hypotension from the surgical field. شوف البيشنت البلد اوزماته بدا يقل. Or if you are in the abdomen, you see the pulse of the aorta become weak. So it might be the first sign of allergic hemolytic reaction during blood transfusion. This cascade is known for you. Acute tubular necrosis, medical integrity. It is one of the constituents of hemolysis because there will be deposition on the hemolytic products in the tubular cell and leading to acute tubular necrosis.
unilateral kidney مو bilateral. unilateral مو bilateral.
ليش unilateral؟
يعني مرات يجي unilateral بينما هذا يجي دائما bilateral.
Usually bilateral.
hemolytic.
Yes. One of the causes of DIC, major blood transfusion, which is antigen antibody complexes with deposition in the various parts and stimulation of the complement system that ultimately will lead to DIC. Treatment, okay, it is very well known for you now. Identification check. Laboratory criteria. What about delayed transfusion, hemolytic transfusion reaction? Previous sensitized in the previous one, and second set of transfusion will have the hemolysis. It is not very common, about 1 every 6,000, and not preventable because you cannot know which patients have been sensitized in the previous reaction and which patient is not. The same as, but rather the less abrupt clinical course. What about febrile reactions? Most of the patients receiving blood will have some sort or another of simple rise in body temperature. That's why we don't advise to give blood to a patient with fever. Why? Because the febrile reaction will be either a single febrile reaction or it is a cover of another type of reaction. So you have to decrease the body temperature before giving the blood to the patient. Yes?
Can I give him all the blood?
All?
All the blood, not fresh.
Why?
because
desensitized?
because size راح تكون قليلة بالأوض فيعني أعطيه أوض.
It makes no difference. The reaction will happen. immunity does not depend on the dose. The immune reaction will happen, but say the amplitude of the reaction will be much less. Of course, with the usual measure of the modern antisepsis and lab precautions, bacterial contamination become less and less. Rigor and fever and other systemic symptoms such as hypotension and nausea, vomiting might occur immediately. What sort of bacteria that will contaminate the blood usually is the Pseudomonas species, coliform and Yersinia. Pseudomonas can grow at low temperature. Yes? And are the most common, do not transfuse the green or purple units. Labeled. Platelets kept at room temperature during the 5 days half-life are a great culture media, especially for skin staphylococcus from the venipuncture. First of all, you have to notify the blood center because this might not be the only contaminated unit, so they have to take sample and examine the other units. RDS does not differ from other type of RDS that happen in other causes. And I suppose that you know the presentation and the treatment of RDS. Toxicity, the most important, is potassium. And this especially happens in all the stored blood or hemolyzed sample, hemolyzed blood sample. Hypothermia, as we told you, it is a major cause of reaction and complication and massive blood transfusion, which is not rewarmed before giving to the patient. Overtransfusion, rapid transfusion of blood, plasma expansion, IV fluid regulates the bleeding time 2 to 4 hours each valve, and central venous monitoring and diuresis. Most of the hypothermic people will have a prolonged bleeding time due to malfunction of the clotting factor. Transmission of certain diseases, you have to know them: cytomegalovirus, malaria, Chagas disease. What is Chagas disease? ما موجود عندنا هنا. تعرفونه؟ It is not present, but المصدر ذاكرها. Chagas disease is a sort of trypanosomiasis, special type of trypanosomiasis. Cytomegalovirus, hepatitis, whether B and C, and HIV, of course, is a dramatically potential complication. Rarely, unless the patient has in the acute stage of hepatitis, hepatitis A is very rare and usually asymptomatic. ترتاحون شوية لو ننطر المحاضرة الثانية. 5 دقائق؟ Yes. is the difference between sterilization and disinfection? The difference is simple, in that during disinfection, we only kill the active part of the microorganism, and we leave the dormant part of the microorganism. Let's translate this sentence in terms of bacteriological terms. What do we mean by the active part of the microorganism? It is the living, mature bacteria. تقول شو اسمه؟ إيميل؟ علاء. شو تقول علاء؟
إيه.
مو رايك؟ زين معكم جواب هسه انتم هاي المحاضرة اليومكم ما طايرة، راح تاخذوها وياكم بالبيت. بس هنا يجوز احكي لك حكاية ما موجودة بالمحاضرة، تفيدك أكثر. So, what is the dormant part of the infectious process? It is the spores. It is the non-responding microorganism to the disinfection. All of these will be kept under the cover and can reactivate again and cause infection. So sterilization is a major process while disinfection is not. This question is frequently asked. What is the difference between sterilization and disinfection? طالما both of them involve killing of microorganisms. So, if you want to sterilize, definitely you will need different measure from that you need to disinfect. And this is the gate of our lecture. A physical or chemical process that completely destroys or removes all microbial life including spores. شوفوا شلون ترجمة هسه هاي صارت الحكي اللي قلناه. While disinfection is the killing or removing of the harmful microorganism, or in other books are called in the active microorganism in front of your eyes. Disinfection products used to kill microorganism or inanimate object or surfaces. Inanimate, you turn them to be microorganism free, or in other words, live microorganism free. While dormant microorganism might not be free. شفت الفرق؟ Disinfectants are not necessarily sporicidal, although sterilizing agent might be disinfectant. Or in other words, most of the sterilizing agents are disinfectants. While disinfectant might be sporostatic, inhibiting the germination or outgrowth. So it temporarily stops the growth of the spores of the microorganism, but the spores, can it be reactivated or not? Yes, it can be reactivated. Antiseptic, a product that destroys or inhibits the growth of microorganism or in or on living cell tissue. Aseptic, characterized by absence of pathogenic microbes. So sometimes we hear about aseptic inflammation. مثلا شنو عندنا؟ To an example of aseptic inflammation. No, it's usually septic. Because colonization after injury. But the classical example is, yes?
So after prosthetic implantation,
Huh?
prosthetic implantation?
Septic.
Arthritis?
Huh?
Arthritis? Arthritis?
Yes, aseptic arthritis. Aseptic urethritis. Any inflammation does not encounter a microorganism within it is called aseptic inflammation. And the classical example is aseptic arthritis. Because you have a lot of causes for arthritis to happen without microorganism. And include mechanical, autoimmune, chemical, all of these can happen within the joint. Chemical urethritis is a common. It is aseptic arthritis, urethritis. Keratitis, an inflammation of the cornea. Conjunctivitis, it's very common. Allergic conjunctivitis. Allergic dermatitis. All of these. Vasculitis, don't forget vasculitis. Where it happened?
Blood vessels.
Blood vessel mainly,
Smaller blood vessels.
mainly the venous side of the blood vessel or vascular bed. Venous vasculitis is very common, especially in collagen disease. All of these are called aseptic inflammation. What are the methods of sterilization? Physical methods, which is hard, heat, dry or moist heat, radiation, ultraviolet or ionizing radiation. The other third is filtration, and the other type is chemical. Number one, physical. Two, chemical. عم سؤال enumerate the type of sterilization. يجي سؤال يمكن بالفاينل. Method of sterilization radiation, we told you either ultraviolet or ionizing radiation, which is gamma radiation, source cobalt, and the physical character of it is described in the slides. The other one is filtration, may be done under either negative or positive pressure, but known example is the membrane filter made for the cellulose. Generally remove most bacteria and viruses and some small bacteria, e.g. chlamydias. Mycoplasma may pass through. Thus, filtration does not technically sterilize all items, but it's adequate for circumstances under which it is used. Main use for heat-labeled substances, e.g. sera and antibiotics. The recommended size filter that will exclude the smallest bacteria is 0.22 microns.
بس دكتور السيرة شنو؟
سيرة جمع سيرم. سيرة جمع سيرم. Sterilization by heat, which is most commonly used in the theater, which is two types, either dry heat or moist heat. Dry heat, simplest method is exposing the item to be sterilized to the naked flame, e.g. Bunsen burner for sterilizing bacteriological loops, knives and blades. hot air even expose item to 160 degrees centigrade for 1 hour. it will sterilize all bacteria. Used for metals, glasswares, ointments, oils, waxes, powders, e.g. items that taking water. Moist heat used hot water. Moist heat kills microorganisms by denaturation of the protein. While boiling, quite common, especially in domestic circumstances. Tendilization, named after John Tyndall's. شنو tendilization? Lengthy process designed to reduce the level of the activity of sporulating bacteria that are left by the simple boiling water method. Tendilization, the process involves boiling for a period, typically 20 minutes, at atmospheric pressure, cooling, incubation for a day, then boiling, cooling, incubator for a day, then boiling, cooling, incubating for a day, and finally boiling again. 3 steps. The 3 incubation period are to allow heat-resistant spore surviving the previous boiling period to germinate to form a heat-sensitive vegetative growing stage. We re-attack them by another boiling. After allowing them to be partial growth to reach the sensitive stage of the spore life اللي هو يسمونه vegetative stage. شلون استوى طالع يقدر يصير مايكرو اورجانيزم ماشي واضح؟ The procedure only works for a media that can support bacterial growth. It will not sterilize plain water. Moist heat, other type of moist heat is the pasteurization, and you mean pasteurization, you know, the raising of the temperature to kill microorganism liable for, and the classical example is the milk pasteurization. And the temperature may be 138 degrees centigrade for a fraction of seconds, flash methods, and 71 degrees centigrade for 15 to 20 seconds, or 60 degree or for 30 seconds. Okay, صحيحات. What is autocleaving? It is a standard sterilization method in hospital. The autocleave or cleave works under the same principle as the pressure cooker, مثل قدور الضغط, where the water boil at increased atmospheric pressure. That's to say, because of the increased pressure, the boiling point of the water راح يصير أكثر من شنو؟ تعرفون العلاقة الطردية؟ العلاقة الطردية ما بين نقطة الغليان والضغط. تعرفوها؟ تعرفوها ولا ما تعرفوها؟ إذا عندك مي حاطة بالضغط الجوي بيشغلي ب 100 درجة مئوية. زين إذا حطيتها بمكان ضغط العالي أكثر من 1 أتموسفير، خلينا نقول 2 أتموسفير. ايش راح يصير؟ درجة الغليان. هذا الضغط راح يساعد الجزيئات ويخليها ما تغلي بالمية. تحتاج أكثر من تمبرتشر حتى تغلي بيها. لذلك it allows reaching a higher temperature before being changed to water vapor. ولما يصير water vapor بعد احنا ما عندنا مجال
لأن إذا ظلت تغلي راح يطق. واضح كلام ولا ما واضح؟ راح يزيد البرشر وينفجر. ولهذا راح نخليه احنا يغلي بس بال 120. فالوتر فيبر شو وقت راح يبدي يصير به برودكشن؟ بال 120. زين المايكرو اورجانيزم اللي هي مو سنسيتيف للكيلينج باي 100% باي 100 ديجري سنتيجريد. ايش راح يصير بيها؟ تموت وين؟ And this is the principle of autoclave. فهمتوا بابا؟ And this is what we are doing in the hospital. عندنا autoclave تقريبا اكبر عندنا جام اكبر من هذا. يضغط الكونتنت اللي داخله، يزيد الضغط مالتها ونسلط حراره. قبل ما يغلي المي كل المايكرو اورجانيزم ميت. واضح؟ طبعا احنا كلنا انه مويست اوريدي واشد، فهذا يجينا بعد دراي. هذا المثل هاف، شوفوا هذا this is the way. هذا بالباب مالت البوابه. اذا تحبون روحوا ويا التعقيم ما تداومون الثياتر، يقول لهم نريد نشوف الاوتوكليف. هذا شغلكم يعني. احنا دائما نعقم به هذا الباب وهذا القفل مال الباب مثل قاصه وروحها استنوا يبشر. advantage شنو الادفانتج؟ temperature اكثر من 100 therefore spores are killed. Condensation of steam generate extra heat. The condensation also allows the steam to penetrate rapidly into the porous material. مثلا قماش مال عمليات او هاي السكر. ومنقع حتى الهاي بريشر ستيم الموجود به راح allow penetration of the pores. من هذا يدخل الداخل. مثلا عندك مثلا مش مال هرنيه. هاي مو بيها بورس ومنقع حتى فانتيسبتيك مثلا ستيرايل ووتر. طبعا بيفتح. لما تجي الضغط عليها كل البورز راح يطب بها الستيم اللي هو على درجه حرارته اكثر من 120. فحتى السبور الموجود داخل المش وداخل البورز مال المش والبي شنو؟ والبي كلير؟ The autoclave items must be steam permeable. Cannot be used for items that are lacking water. يعني هو احنا شغلنا بالوتر. Monitoring of the autoclave احنا نخلي عادة كلر. هاي شوفها الكلر لما نغير لونه معناه احنا there is no more autoclaving can be done. حتى لا يصير بيرن. واضح ولا واضح؟ لما يجي هو اكو نخلي في الماده بي لما يتغير لونها للجرين نقول يعني وصلنا ل 120 او وصلنا ل 130 احنا اكو certain degree نخلي عليها. لما يصير يتغير اللون نفتح الباب واصل اللون نقول اوكي افتح هذا طلع لك. واضح؟ هاي مونيتورنج. The meat consists of three sensitive chemical that change the color to the right temperature to expose time. اللي هو autoclave tape أو brown ستيول. Chemical sterilization اللي تعرفونه. Ethylene oxide, activated alkaline, glutaraldehyde اللي تحفظوهم فقط لا أكثر ولا أقل. Disinfection, what are the factors؟ هم جبنا سؤال. هذا جبنا سؤال يمكن الصور أو العام. من المرحلة اللي تخرجت. Directly, what are the factors اللي هي influencing the activity of the disinfectant. هذا اللي نحددون إياه. Hypochlorite and glutaraldehyde are more active against hepatitis viruses. مرات نجيب سؤال بيقول the following are active against such microorganism.
تختارون اللي انا قايل لكم اياه. هذول كل وحده حاجيكم عليها. فينول اند فينولكس، او فينايل فينول، هكساكلورافين، تراي كلوزان، وبايبونايز وهالوجينز. هذا الايودين هو مهم، هو الكلوراين، الايودين والكلوراين. الكحول is a major disinfectant موجود. هذا نستعمله in the era of corona. في من هذا البطل ما يمشي خارج هذا بجيبه على لا يدخل شيء اليوم. يقولون صالح جديد هسه متحول. ها؟ متحول اكس. تذكرون هاي السلسلة مال المتحولون؟ مال اكس مان؟ ترى هي ذا سيم بالمناسبة. ما ادري تدرون او ما تدرون انتم؟
شلون؟
لاب برودكشن. لاب برودكشن. انتم تشوفون كل ال صار تقرون التاريخ مثلا خلينا نسميه الابيديميك اللي صار
كل 100 سنة.
كلها ايش قد صارت؟
100 سنة، كل 100 سنة.
اي بس ايش قد صارت؟ 1 تايم لو 3 تايمز لو 1 تايم.
شلون
يعني لما اجى الفيروس وضعف صار بعد اتاكس وراه. ليش هذا اللي يذاك الفترة النووية؟ اقرأ لا اقرأ. انتم دائما اقرأوا، لا تعتمدون على الميديا، انت اهم شيء اقرأ مخك. يعني الله اعطاك برين يعني وريزنينج، فانت دائما اهم شيء اقرأ مخك. Why in this time? Why now? Why here? Why not there? ما عندنا بعد عندنا هاي الهيفي ميتالز tiny amount of heavy metals silver nitrate وسيلفر سلفات زي الديازين mercuric chloride وكبر سلفات وزنك كلورايد. وهذا الفاكتور. الفاكتور مهم. إذا كم سؤال أعطيتكم أنا مهم؟ المحاضرين ما يدرون به. I will be glad for any question. ولو انتم نايمين.
دكتور
حقكم لا ننتم.
دكتور الهيموليتيك هم يصير بها جوندس؟
هيموليتيك جوندس. Hemolytic jaundice. And the type of the